Welcome to the deep dive. Today we're focusing on something, well, you interact with it every single day, your skin.
Interesting.
We're going deep into dermatology and aesthetic medicine,
Okay.
using excerpts from MIMS Dermatology and Aesthetic Medicine.
Yes.
Basically, it's like a go-to guide for dermatologists.
Yeah.
We'll cover a range of topics.
Okay.
From common conditions like acne to, cutting-edge aesthetic treatments with practical insights that you can actually use.
I think what I find so fascinating about this resource is that it not only provides like a really comprehensive overview of all these different skin conditions, but it also like dives into the science behind them.
Yeah.
And the latest treatment options. And it even talks about the role of nutrition in maintaining healthy skin.
Okay, let's kick things off with something that I think a lot of people struggle with.
Okay.
Atopic dermatitis, which is basically like really bad eczema. One thing that surprised me is that it's not just about the unbearable itching.
Right.
There could be actual pain involved.
Oh, wow.
What causes that?
So in atopic dermatitis, the skin's barrier is compromised.
Okay.
So imagine it like a wall with cracks in it. And these cracks allow irritants to get in and trigger those pain receptors.
Okay.
Leading to that, uncomfortable, sometimes even painful sensation.
That makes sense.
Yeah.
So it's not just about dryness, it's about a weakened defense system
Exactly.
for your skin.
Yeah.
I see the source material mentions. You need a combination of major and minor features for a diagnosis.
Yes.
Things like, itchy skin,
Right.
a history of eczema, and even specific patterns of dryness. That seems pretty thorough.
Yes.
But here's a real head scratcher.
Okay.
It says soaking in salt baths can actually help.
Right.
Wouldn't that dry things out even more?
That's a common misconception.
Yeah.
While you might think salt would be harsh on the skin, it actually helps gently exfoliate.
Okay.
So it removes that buildup of dead skin cells that can exacerbate atopic dermatitis.
Oh, interesting.
Yeah, think of it like a natural way to help your skin shed what it doesn't need.
So it's like a reset button for your skin.
Exactly.
That's really interesting. Another surprise for me is that using topical antihistamines
Yeah.
can actually make things worse.
Right.
Any idea why that is?
Well, you see, topical antihistamines, while helpful for some allergies, they can further irritate the already sensitive skin
Oh, okay.
of someone with atopic dermatitis.
Yeah.
So instead of providing relief, they kind of add fuel to the fire.
Oh, wow.
So if you're looking for itch relief, oral antihistamines are a better option.
Okay.
As they work internally to block those histamine reactions.
So it's about calming things down from the inside out.
Precisely.
Speaking of calming things down,
Yeah.
let's move on to another. Common skin concern.
Okay, acne vulgaris. So many people think there's a magic bullet for acne.
Right.
But this source material emphasizes that medications can take weeks to work.
Oh, yeah.
It's a marathon, not a sprint, right?
Absolutely. Acne vulgaris is a chronic condition. And you have to remember that you're dealing with multiple factors.
Yeah.
Excess sebum production,
Okay.
clogged pores, also known as comedones, and the proliferation of C. acnes bacteria.
Right.
It's a complex process that takes time to address effectively.
And it's not just one type of acne either.
No.
The source material describes comedonal acne with blackheads and whitehead, inflammatory acne with those, red, angry bumps,
Yeah.
and even nodular acne, which sounds pretty intense.
And we can't forget conglobate acne.
Oh, right.
The most severe form, which can lead to significant scarring.
Wow.
And requires aggressive treatment. And this really highlights the importance of consulting a dermatologist.
Yeah. Instead of relying on self-treatment, which can often lead to frustration.
Right.
And potentially worsening of the condition.
There's always that debate about diet and acne.
Oh, yeah.
Does chocolate really cause pimples?
No.
The source material seems to say that what we eat does play a role.
Right.
But it's more nuanced than that.
Exactly. It's not as simple as saying one specific food causes acne. However high glycemic index foods,
Okay.
which are quickly absorbed and lead to a rapid spike in blood sugar,
Yeah.
have been linked to increased sebum production
Right.
and inflammation,
Okay.
both of which can contribute to acne. Some studies also suggest that dairy might also play a role for certain individuals.
So it's more about being aware of how different foods might impact your skin.
Exactly.
And working with a dermatologist or a nutritionist
Yeah.
to figure out what works best for you.
It's about personalized nutrition.
Right.
And understanding how your body responds to different foods.
Yeah.
And of course, managing acne effectively often involves a multi-pronged approach.
Okay.
That includes keeping your skin clean, avoiding harsh scrubs, using topical agents like retinoids and benzoyl peroxide, and sometimes even systemic agents like oral antibiotics or isotretinoin in severe cases.
It's about understanding the complexity of the condition and finding the right combination of strategies. Now let's shift gears to something that can be emotionally challenging.
Okay.
Hair loss, or alopecia, as it's medically known.
Right.
I was surprised to learn there are so many different types.
You're absolutely right. Alopecia is an umbrella term encompassing a wide range of conditions that cause hair loss.
Wow.
And we can categorize it in several ways.
Okay.
Localized versus generalized, meaning is it just in one spot or all over?
Yeah.
Scarring versus non-scarring, meaning does it damage the hair follicle?
Interesting.
And abrupt versus gradual onset, meaning did your hair fall out suddenly or slowly over time? So this helps us understand the underlying causes and guide treatment.
The source material mentions a scoring system called SALT.
Yes.
For alopecia.
Yeah.
So dermatologists are out there measuring our hair loss with salt shakers now. What are some of the most common types of alopecia we should know about?
So androgenic alopecia or pattern baldness is probably the most familiar. This is the type of hair loss that typically follows a specific pattern. Affecting men and women differently.
Right.
Then there's alopecia areata, which is an autoimmune condition where the body's own immune system attacks the hair follicles.
Wow.
Leading to patchy hair loss.
Okay.
This can be particularly distressing because it often happens suddenly and can be unpredictable.
It's like your body's turning against itself, which must be incredibly difficult to deal with.
It is.
And the treatments vary depending on the type of alopecia, right?
Exactly. Treatment for androgenic alopecia might involve medications like minoxidil or finasteride, while alopecia areata might be managed with corticosteroids or other immunomodulatory therapies.
Gotcha.
It's crucial to consult with a dermatologist to determine the best course of action.
Right.
Based on the underlying cause and the individual's specific needs and preferences.
It sounds like a case-by-case situation, which makes sense.
Absolutely.
Now let's talk about something we all have experience with.
Okay.
Scars.
Yes.
Some we cherish, others we'd rather forget.
Right.
The source material breaks down different types of scars, like hypertrophic scars.
Right.
That stay within the boundaries of the original wound. And then there are keloids.
Keloids are fascinating.
Yeah.
Because they kind of go beyond the original injury site. Almost as if the scar tissue has a mind of its own.
Oh, wow.
Growing and spreading.
Yeah.
And we classify them as major, which are raised and lumpy, or minor, which are flatter and less noticeable.
Okay.
They can be challenging to manage and often require a multifaceted approach.
I see the source material mentions silicone therapy.
Yes.
For scar management. Is that as simple as it sounds? Just like slapping on some silicone and voila, the scar disappears.
It might sound simple, but silicone therapy is surprisingly effective.
Okay.
Silicone sheets or gels create a barrier over the scar, helping to regulate moisture and collagen production.
Gotcha.
This leads to flatter, softer, and less noticeable scars.
So it's like gently coaxing the skin into healing more smoothly.
Exactly.
What other options are out there for those tougher scars?
So there are intralesional injections with corticosteroids to reduce inflammation and flatten raised scars. Pressure therapy, which involves applying continuous pressure to the scar, can also be helpful.
Right.
In more severe cases, surgical excision or laser therapy might be necessary to remove or reshape the scar tissue.
It's amazing how far scar management has come.
It really is.
Next up, we're tackling melasma. Those patches of darker skin that can be so frustrating to deal with.
Yes.
I honestly had no idea there were different types.
Melasma is all about pigment.
Okay.
There's epidermal melasma, affecting the top layer of skin. Dermal melasma, which is deeper.
Right.
And then mixed melasma, a combination of the two.
Interesting.
And a Woods lamp, which emits ultraviolet light, helps us differentiate the types.
Oh, wow.
And determine the most effective treatment approach.
So it's like a detective tool
for
pigment problems.
Yeah.
Speaking of treatment, The source material emphasizes sun avoidance as a key strategy for managing melasma.
Absolutely.
Makes sense, considering sun exposure can worsen those dark patches.
Yes.
It also mentions sunscreens and camouflage makeup as non-pharmacological approaches. But what about glutathione? That's a popular supplement.
Right.
I've seen touted for skin lightening.
Okay.
What does the research say about its effectiveness for melasma?
Glutathione is gaining traction as a potential treatment for melasma.
Okay.
Because it's a powerful antioxidant and has anti-inflammatory properties.
Yeah.
It's thought to work by inhibiting tyrosinase, an enzyme involved in melanin production.
Gotcha.
So essentially, it helps reduce the production of pigment,
Right.
which can lead to a lightening of those darker patches.
So it's like a double whammy.
Yeah.
Fighting free radicals and reducing pigment production.
Exactly.
It sounds like a natural alternative to those harsh topical creams.
Right.
I'm seeing a theme here.
Oh, yeah?
Addressing skin issues from the inside out.
Absolutely.
The source material also mentions a bunch of topical agents.
Yes.
Like hydroquinone, kojic acid, and azelaic acid.
Right.
And, of course, there are always chemical peels.
Exactly. There's a whole arsenal of options available to target those stubborn patches.
Yeah.
It really speaks to the advancements in dermatology.
Yeah.
And the focus on personalized treatment plans.
Right.
What works for one person may not work for another. So it's all about finding the right combination of strategies to achieve the desired results.
Now let's talk about a condition that affects millions worldwide.
Okay.
Psoriasis. I think most people are familiar with those raised, scaly patches.
Yeah.
But the source material really breaks down the different types.
Right.
And the science behind this chronic inflammatory disorder.
Yes.
What should our listeners know about the different types of psoriasis and their impact?
Well, psoriasis is much more than just a skin condition.
Oh, okay.
It can also affect the joints, leading to psoriatic arthritis.
Wow.
And there are several types, each with its own unique characteristics.
Okay.
The most common is plaque psoriasis, with those classic thick red patches covered in silvery scales.
Right.
Then there's guttate psoriasis, which often appears as small dot-like lesions, usually triggered by a strep infection.
Oh, wow.
Inverse psoriasis occurs in skin folds and creases, while pustular psoriasis presents with pus-filled bumps. And finally, there's erythrodermic psoriasis, the most severe form, which can affect the entire body.
Wow.
And require immediate medical attention.
It's amazing how one condition can have such diverse manifestations.
It is fascinating.
Psoriasis can be really tough to manage, both physically and emotionally.
Yes.
What are some key things someone struggling with psoriasis should know about treatment options?
The good news is that there have been incredible advancements in psoriasis treatment in recent years.
Oh, good.
The approach depends on the severity and the individual's response.
Oh, okay.
For milder cases, topical therapies like corticosteroids or vitamin D analogs might be sufficient. Phototherapy, using UV light, can be effective for moderate to severe psoriasis.
Right.
And in the most severe cases, systemic therapies like methotrexate or biologics, which target specific parts of the immune system, may be necessary.
It's a reminder that there's hope for those dealing with psoriasis.
Absolutely.
And that seeking professional help is crucial. There's no one-size-fits-all solution.
Right.
And a dermatologist can help tailor a treatment plan that addresses the specific needs of each individual.
Absolutely. And with the ongoing research and development in this field, there are constantly new and innovative treatment options emerging.
Oh, wow.
Offering even more hope for those living with this challenging condition.
Okay, moving on to something I think we've all seen at some point,
Okay.
maybe even experienced ourselves.
Yeah.
Tinea unguium,
Right.
or as it's more commonly known, nail fungus.
Exactly.
It's not exactly a glamorous topic, but it's something that many people deal with.
Yeah.
What does the source material say about tackling this stubborn condition?
Well, Tinea unguium is specifically caused by dermatophytes,
Okay.
which are a type of fungi that thrive in warm, moist environments. That's why it commonly affects toenails more than fingernails,
Right.
especially if you wear closed-toe shoes that trap moisture. It causes the nails to become thick, discolored, and brittle,
Right.
which can be both unsightly and uncomfortable.
So those sweaty gym shoes might be a breeding ground for nail fungus.
They can be.
Are there certain things that increase your risk?
Yeah.
I've heard that diabetes and aging can make you more susceptible.
You're right. Certain factors can increase your risk of developing tinea unguum.
Yeah.
Along with diabetes and aging, peripheral vascular disease, which affects blood flow to the extremities, can also make you more susceptible.
Gotcha.
And as you mentioned, occlusive footwear, basically anything that traps moisture around the feet, can create the perfect environment for those fungi to thrive.
So it's about being aware of those risk factors and taking preventative measures like keeping your feet dry and avoiding tight shoes.
Exactly.
But what if you already have nail fungus?
Yeah.
What are the treatment options?
Right.
I remember my grandmother soaking her feet in vinegar, but I'm not sure how effective that really is.
While home remedies like vinegar soaks might have some anecdotal support,
Okay.
the most effective treatments for tinea unguum are antifungal medications,
Okay.
available in both oral and topical forms.
Oral antifungals for nail fungus.
Yeah.
So it's not just about treating the nail itself, it's about addressing the fungal infections systemically.
Exactly. Oral antifungals can be very effective, but they do come with potential side effects and might interact with other medications.
Right.
So it's important to consult with your doctor to see if they're the right option for you. Topical antifungals are another option, but they're generally less effective for severe cases because they have a harder time penetrating the nail bed.
It sounds like a case where early intervention is key.
It can be, yes.
Now let's talk about a condition that, while not life-threatening,
Okay.
can have a significant impact on a person's self-esteem
Right.
and quality of life, vitiligo.
Yeah.
This is the condition that causes patches of skin to lose their color. What insights does the source material offer on the different types of vitiligo and the science behind it?
Well, vitiligo is another autoimmune condition.
Okay.
But unlike alopecia areata, which targets hair follicles,
All right.
vitiligo targets melanocytes, the cells responsible for producing pigment.
Okay.
This loss of pigment leads to those characteristic white patches on the skin.
Right.
We categorize vitiligo as either non-segmental, where the depigmentation appears on both sides of the body in a symmetrical pattern, or segmental, where it's localized to one area, usually following a nerve path.
So it's like your immune system is playing a game of connect the dots, but with your pigment cells.
Yeah.
The source material also mentions scoring systems for vitiligo.
Right.
I guess dermatologists aren't using salt shakers for this one.
Wow.
What are some of the treatment options available?
Well, treatment options for vitiligo are quite diverse
Okay.
and depend on factors like the extent of depigmentation, the individual's response to previous treatments, and their personal preferences.
Right.
We have non-pharmacological approaches, like sunscreens, to protect the depigment skin from sun damage, and camouflage cosmetics to help conceal the white patches. Then there are pharmacological therapies like topical corticosteroids or calcineurin inhibitors to help repigment the skin.
Okay.
And believe it or not, there are even surgical options for vitiligo.
Surgical options? That's surprising.
It is.
I wouldn't have thought surgery would be a viable option for a pigmentation disorder.
Right.
What does that involve?
Well, for those who haven't responded well to other treatments, surgical procedures like skin grafting or melanocyte transplantation can be considered.
Wow.
Skin grafting involves taking a thin layer of skin from another part of the body and transplanting it to the depigmented area.
Right.
Melanocyte transplantation is a more specialized procedure.
Okay.
Where melanocytes are extracted from a donor site, cultured in a lab, and then transplanted to the affected areas.
That's incredible.
It is pretty amazing.
It shows how far medical science has come in addressing these challenging skin conditions.
Yeah.
It's not just about covering up the problem anymore. It's about finding ways to restore what's been lost.
Exactly.
Speaking of restoring what's been lost.
Yeah.
Let's shift gears and talk about something that's essential for everyone. Skincare and nutrition. What does the source material say about the role of nutrition in maintaining healthy, radiant skin?
This is where the connection between what we put in our body and how it shows up on our skin becomes crystal clear. The source material emphasizes the importance of a balanced diet, rich in vitamins, minerals, and antioxidants, for optimal skin health. Think of it like giving your skin the building blocks it needs to thrive.
So it's not just about the creams and serums we slather on.
No.
It's about nourishing our skin from within. What are some of the key nutrients we should be focusing on?
Okay.
I know vitamin C is good for collagen production, but what else is on the A-list for healthy skin?
You're absolutely right about vitamin C being a superstar for skin health. It's a powerful antioxidant that helps protect the skin from damage
Right.
and is essential for collagen synthesis.
Okay.
But there are many other key players.
Yeah.
Vitamin A, particularly in the form of retinol,
Okay.
is crucial for cell turnover and can help reduce wrinkles and fine lines.
Interesting.
Vitamin D plays a role in skin cell growth and repair,
Okay.
while vitamin E is another potent antioxidant that protects against sun damage.
So it's like an all-star team of vitamins
Exactly.
working together to keep our skin looking its best.
Yeah.
Are there any minerals we should be paying attention to?
Well, zinc is an essential mineral that plays a role in wound healing and helps control oil production, making it beneficial for those with acne-prone skin. Selenium is another powerful antioxidant that protects against sun damage
Right.
and may help prevent skin cancer.
Wow.
And let's not forget about the B vitamins,
Yeah.
which are crucial for cell metabolism
Okay.
and can help improve skin tone and texture.
It's fascinating how all these different nutrients work together to support our skin health. It's like a complex ecosystem within our bodies.
Yeah.
The source material also mentions some other interesting components, like coenzyme Q10, flavonoids,
Right.
and even probiotics.
Yeah.
Probiotics for your skin. That's a new one for me.
It might sound surprising,
Yeah.
but a healthy gut microbiome is increasingly being recognized as a key factor in overall skin health.
Oh, wow.
Probiotics can help support that healthy balance of bacteria in the gut, which can in turn reduce inflammation
Okay.
and strengthen the skin's barrier function.
So it's not just about what we put on our skin, it's about what we put in our bodies as well. It's a holistic approach to skin health. Absolutely.
And speaking of what we put on our skin, the source material also outlines a basic skincare routine.
Yes.
What are the essentials?
Think of it as a simple but effective three-step process. Cleanse, moisturize, and protect.
Okay.
Start with a gentle cleanser to remove dirt, makeup, and impurities without stripping your skin's natural oils.
Got it. No harsh scrubs.
Exactly.
Or anything that leaves your skin feeling tight and dry.
Yeah.
And then moisturizing is key to keep that skin hydrated and plump.
Absolutely. A good moisturizer helps maintain that crucial moisture barrier, which is essential for healthy, radiant skin.
Yeah.
And finally, the most important step of all.
Okay.
Sun protection.
Sunscreen.
Yes.
It's the holy grail of skincare.
It is.
I think we've drilled that one in pretty well by now.
And for good reason, daily sunscreen use is non-negotiable.
Yeah.
It's your best defense against premature aging, sun damage, and skin cancer. Look for a broad-spectrum sunscreen with an SPF of 30 or higher.
And apply it liberally to all exposed skin every day, rain or shine.
So a simple yet effective routine can go a long way in protecting and maintaining healthy skin.
Absolutely. It can.
All right, so that wraps up part 1 of our deep dive into the world of dermatology and aesthetic medicine.
Okay, great. Welcome back to the deep dive.
Thanks for having me back.
So last time we talked about all these common skin conditions.
Yeah, a lot of those I think affect a lot of people.
Right, and I think a lot of people want to know about what to do about them.
Yeah, like how can they improve their skin?
Well, that's what we're talking about today.
Aesthetic medicine.
Yeah, how to make your skin look its best.
That's right. We're using that same source material as last time.
MIMS Dermatology and Aesthetic Medicine.
It's a great resource for dermatologists.
It really is.
And for anyone who wants to learn more about this stuff.
So what are we diving into today?
Well, the source material covers a lot of different procedures
Okay.
and treatments that are designed to enhance your appearance and address those pesky signs of aging.
Like wrinkles.
Yeah, wrinkles, fine lines, age spots, all that fun stuff.
It's amazing how many options are out there these days.
I know, it's mind-boggling.
So how do we even begin to break all this down?
Well, the source material categorizes aesthetic procedures into 3 main categories.
Let's hear it.
Non-invasive, minimally invasive, and invasive.
Okay, that makes sense.
So let's start with non-invasive procedures. These are the ones that don't require any incisions or needles.
So no surgery.
No surgery.
Interesting.
Think of it as surface-level rejuvenation.
I like that.
So these treatments work on the outer layers of the skin to improve tone and texture and reduce the appearance of those fine lines and wrinkles.
So what are some examples of non-invasive procedures?
Well, there are chemical peels, microdermabrasion, and certain types of laser treatments.
Okay, so those are all considered non-invasive.
That's right.
Chemical peels sound a little intense, though.
I know, right?
Is it like they're actually peeling off a layer of your skin?
It's not as dramatic as it sounds.
Okay.
It's a controlled process
All right.
that removes dead skin cells and stimulates cell renewal.
So it's like exfoliating on a deeper level.
Exactly.
And what about Botox?
Ah, Botox.
Everyone's heard of Botox.
It's one of the most popular non-invasive procedures.
Yeah. Why is that?
Well, it's incredibly effective at reducing the appearance of wrinkles.
Okay.
Specifically those wrinkles that form when we make facial expressions.
Oh, like frown lines?
Yeah, exactly. Frown lines, crow's feet, those kinds of things.
So how does Botox actually work?
It temporarily relaxes the muscles
Okay.
that cause those wrinkles.
Does it freeze your face?
That's a common misconception.
Oh, okay.
Botox doesn't actually freeze your face.
Okay.
It just relaxes the muscles, so they're not contracting as much.
That makes sense.
So it's like hitting the pause button on those repetitive muscle movements
Right.
that etch lines into our skin over time.
That's a good way to put it.
So it's like a temporary truce with gravity.
I like it.
And now let's talk about fillers.
Okay, fillers are popular too.
They are everywhere these days.
So are those considered non-invasive as well?
Fillers are actually minimally invasive.
Okay, so there's a little bit more involved.
Yeah, that's right.
How do they work?
They involve injecting a gel-like substance under the skin to
Interesting.
plump up areas that have lost volume,
Okay.
smooth out wrinkles, or enhance facial contours.
So it's like adding back the cushion that we lose as we age.
That's a great way to put it.
So what are these fillers made of?
There are different types of fillers,
Okay.
each with its own unique properties
Right.
and longevity.
So how long do they last?
Well, it varies depending on the type of filler,
Okay.
but most last anywhere from 6 months to 2 years.
And are they permanent?
No, most fillers are eventually absorbed by the body.
Oh, okay.
So you need to get them touched up every so often
That makes sense.
if you want to maintain the results.
Right.
Now let's move on to lasers.
All right, lasers.
I know they're used for hair removal, but what about skin rejuvenation?
Yeah, how do those work?
Lasers are incredibly versatile tools in aesthetic medicine.
Hair.
For skin rejuvenation, they use targeted light energy
Oh.
to stimulate collagen production,
Right.
reduce pigmentation irregularities.
Like sunspots and age spots.
Exactly.
And can they also improve skin texture?
Yes, lasers can help improve skin texture and tone.
Wow, that's impressive.
It's like a high-tech way to resurface and refresh the skin.
I like it.
And what about microdermabrasion?
Oh, yeah, I've heard of that.
Have you ever tried it?
I haven't, no.
Well, it's a non-invasive procedure
Okay.
that uses a device with tiny crystals.
Crystals.
Yeah, tiny crystals, or a diamond tip
Interesting.
to gently exfoliate the outer layer of skin,
Okay.
revealing smoother, brighter skin underneath.
So it's like a really intense exfoliation.
That's a good way to describe it.
It sounds kind of like sanding down the skin.
Yeah, you could say that.
So we've talked about non-invasive procedures. What about minimally invasive procedures?
Minimally invasive procedures involve breaking the skin,
Okay.
but they're generally less involved than traditional surgery
Right.
and require less downtime.
Gotcha.
A good example is sclerotherapy.
Sclerotherapy.
Well, have you heard of that?
I have, but remind me what that's for.
It's used to treat spider veins.
Oh, yeah, those tiny veins that can appear on the legs.
Exactly.
So how does sclerotherapy work?
They inject a solution into those tiny veins,
Okay.
which causes them to collapse and fade away.
So they basically disappear.
That's the goal.
That's pretty amazing.
It's a relatively quick and simple procedure
Yeah.
with minimal discomfort
Good.
and downtime.
So you can go about your day afterward.
Pretty much.
What about microneedling?
Microneedling is another minimally invasive procedure
Right.
that's been gaining popularity lately.
I've seen it all over social media.
It might sound a little intimidating,
Yeah, it does.
but it's actually very safe and effective
Okay.
when performed by a qualified professional.
So what exactly is microneedling?
It involves using a device with tiny needles.
Needles?
Yeah, tiny needles.
So they're poking holes in your skin.
They are.
Why would they do that?
Well, these micro-injuries trigger the body's natural healing process,
Oh, okay.
which stimulates collagen and elastin production.
Interesting. So it's like tricking the skin into thinking it's been injured,
Exactly.
and that makes it produce more collagen.
That's right.
So it makes the skin look younger.
Smoother, firmer, and more youthful looking.
Wow, that's pretty cool.
So it's like controlled damage that ultimately leads to improvement.
That's a good way to put it.
What about thread lifts?
Thread lifts.
Have you heard of those?
I'm not sure.
Well, those are another minimally invasive procedure
Okay.
that involves inserting dissolvable threads under the skin
Interesting.
to lift and tighten sagging tissues.
So it's kind of like a non-surgical facelift?
Exactly. It's a less invasive alternative to a traditional facelift.
That makes sense.
with less downtime and a more natural-looking result.
I like that.
So are there any non-surgical options for skin tightening?
Absolutely. There are several non-invasive skin tightening procedures
Okay.
that use various technologies,
Like what?
like intense, pulsed, light IPL,
All right.
radiofrequency, or ultrasound to heat the deeper layers of the skin.
And that helps tighten the skin.
Yes, this heating process stimulates collagen production.
So it's like giving your skin a warm hug from the inside out.
That's one way to think about it.
It seems like there's an aesthetic treatment for every concern imaginable these days.
There really does.
It's incredible how many options there are.
But it's important to remember that with any aesthetic procedure, whether it's non-invasive, minimally invasive, or invasive,
Right.
choosing a qualified and experienced provider is crucial.
Absolutely. It's all about prioritizing safety
Yeah.
and making sure you achieve the best possible outcome.
Right. You want to make sure you're in good hands.
Exactly. And it's also important to have realistic expectations and understand that aesthetic medicine is not about achieving perfection.
It's about enhancing your natural beauty
That's right.
and feeling confident in your own skin.
Exactly.
So what about invasive procedures?
Invasive procedures are a bigger commitment, both in terms of recovery time and cost.
That makes sense.
They involve surgery
Okay.
and typically require longer recovery times.
So these are for more significant concerns.
That's right. Things that can't be effectively treated
Right.
with non-invasive or minimally invasive options.
So like facelifts and tummy tucks.
Exactly. Those are classic examples of invasive aesthetic procedures.
Okay.
A facelift or rhytidectomy is a surgical procedure to remove excess skin and tighten underlying tissues.
So it's a pretty major surgery.
It is.
And what about a tummy tuck?
A tummy tuck or abdominoplasty involves removing excess skin and fat from the abdomen. Okay.
And tightening the abdominal muscles.
So it's like a combination of liposuction and skin removal.
You could say that.
It sounds like invasive procedures require careful consideration.
They do.
And a thorough consultation with a qualified plastic surgeon.
It's important to discuss your goals,
Yeah.
expectations, and potential risks and benefits.
Right, to make an informed decision.
This has been quite a journey
It has.
through the world of aesthetic medicine.
From subtle tweaks to major transformations.
It's remarkable how many options are available.
And how safe and effective they can be.
It's all about empowering individuals to make choices
Absolutely.
that align with their personal goals and values.
And feeling good about themselves.
Exactly. Whether it's a simple non-invasive treatment or a more involved surgical procedure.
Aesthetic medicine can play a positive role
in enhancing well-being and self-esteem.
That's a great point.
Welcome back to the Deep Dive. We've been on quite a journey exploring the world of dermatology and aesthetic medicine.
It's been fascinating, hasn't it? Yeah, we've covered a lot of ground. From understanding common skin conditions to exploring all those cutting-edge treatments.
And I think one of the biggest takeaways for me has been just how much our skin reflects our overall health.
Right. It's not just about what we put on our skin, it's about what we put in our bodies, too.
Exactly. Our lifestyle choices, what we eat, our stress levels, all of that plays a role.
The source material we've been using, MIMS Dermatology and Aesthetic Medicine, really emphasizes that connection between nutrition and healthy skin.
It's so important. We talked about all those key nutrients, vitamins A, C, D, and E, minerals like zinc and selenium.
Yeah, it's like building a strong foundation for your skin from the inside out.
Absolutely. And of course, hydration is essential too.
Drinking plenty of water helps keep the skin looking plump and supple.
And don't forget sun protection.
Oh, that's a given, right?
Absolutely. Daily sunscreen, rain or shine. That's non-negotiable for healthy skin.
Another thing that really stood out to me was just how important it is to seek professional help.
Couldn't agree more. Whether you're dealing with a rash, a mole that's worrying you, or thinking about aesthetic treatments, seeing a dermatologist is crucial.
They have the knowledge and expertise to guide you in the right direction.
And I think sometimes people hesitate to reach out for help, but there's really no need for that.
Right. It's about taking control of your skin health and feeling confident in your own skin.
And that's what we've been talking about this whole time, right?
Empowering yourself to make informed choices.
Whether it's a small lifestyle change or a more involved medical treatment, there are so many options out there.
So before we wrap up, we always like to leave our listeners with a question to think about.
Something to ponder as they go about their day.
We've learned so much about how our skin health is connected to so many other aspects of our lives.
So here's a question for you. What's one small change you can make today to take better care of your skin.
Maybe it's adding a new healthy food to your diet, or finally making that commitment to wear sunscreen every day.
Even small steps can make a big difference over time.
Well, that brings us to the end of our deep dive into dermatology and aesthetic medicine. Thanks for joining us.
It's been a pleasure sharing these insights with you.
We hope you learned something new and feel inspired to take good care of your skin.
Until next time, stay curious.